Well, you've heard it said many times that America has the best healthcare system in the world. So why are so many patients complaining? In fact, a recent study found that nearly two-thirds of patients give the top hospitals in the nation, as ranked by U.S. News & World Report, mediocre to poor ratings in their online reviews. Joining us this morning, Harman King, CEO of Vanguard Communications. And Ron, what do you attribute this disparity?
Well, I think I attribute it to a lack of focus in some areas in healthcare. And by the way, I think it's debatable that we have the best healthcare system in the world. We've been ranked as low as 37th, and we have some of the highest infant mortality rates and other indicators of an ailing healthcare system. So that's why I'm here to talk today about some indications of that. My firm did a study of almost 2,700 reviews of Yelp reviews. We're familiar with the website Yelp.com. You can go there and review and read reviews of various businesses, hotels, restaurants, resorts, and doctors and hospitals and so on. And so we looked at 2,700 reviews of these top 20 hospitals as ranked by U.S. News & World Report, which I want to say does a great public service by doing this ranking. They do it purely on clinical performance, though, things like hospital survival rates and nursing levels and so on. They don't really ask the patient what he thinks about hospital experiences. So we looked to Yelp to do that, and of these 2,700 reviews, we've discovered the top 20 hospitals had an average rating of only 3.2 out of 5 stars possible, 3.2 out of 5 stars. And 62.7%, nearly two-thirds of the reviewers on Yelp of these top-rated hospitals gave only 1, 2, or 3 stars.
So what are the biggest complaints? What are the biggest causes of dissatisfaction among these patients?
Well, it's not with what doctors are doing. It's with what people around the doctors are doing. 84% of the complaints were about customer service issues. So that's nearly 9 in 10, 84%. And they really range from everything from availability of good parking to a warm reception to getting a prompt response when you push the button from your hospital bed for help. But the two big areas of concern are phones and billing. Phones in general in healthcare are a huge problem. It's ironic that with all the medical advances we've had, our study of social media reviews indicates that people really have a hard time getting the right person on the phone in healthcare to help them. And that's really true in hospitals. They complain about not getting calls back. They leave messages that are unreturned. They have trouble reaching the right person to the phone, getting good answers on the phone, and so on. That's true across all healthcare. The second area, though, is really a problem for hospitals, and that is billing. There's lots of complaints about overcharges, double billing, and there's a surprising number of people who are put in collections by hospital billing departments because they are not paying their bills in full. Instead, in many cases, they say they've worked out a billing plan, but they are still put into collections.
So, again, and like you said, the rankings, again, when you look at the nation's top hospitals, the U.S. News & World Report ranks, they look at the clinical side of things, and certainly that is very, very important. But are these hospitals unaware that they are falling short in these areas? Do they not feel that it is as important as what goes on in the clinical side of things? I mean, how does this happen?
Well, I'm happy to report there is increasing emphasis on customer service in healthcare, and I think we have the Internet to thank for that. That's because people talk about these things on the Internet more and more, and it's forcing hospitals and all healthcare providers to be more transparent. And there's a lot of buzz these days in healthcare about the so-called patient experience. So to the credit of some hospitals, and there are a couple particularly, the two at the top of the top 20 rankings are especially famous for good customer service. But I think it's otherwise fairly overlooked, and that's because hospitals have so much challenges these days. I think that gives them a pass to some degree, but I don't think it gives them a pass to completely overlook customer service, which is really of high importance. We should really, as healthcare consumers, get the same kind of customer service at hospitals and doctors' office as we expect in hotels and restaurants and resorts.
So with that in mind, since, like you said, for the most part, this is simply going overlooked with all of the other issues that hospitals have to worry about, what then can they do to address these issues? And the flip side of that, how can consumers perhaps better avoid these problems that they seem to that come up that they typically tend to complain about?
Well, those are two great questions, and I'll take the first one, obviously, first. And that is, there needs to be a pretty big culture and paradigm shift within hospitals. I think there is so much focus on good medicine. There needs to be as much emphasis these days on what patients can see more readily, and that is good customer service. There's just a lot of disorganization in hospitals. There's communications breakdowns galore, and this is especially true in emergency rooms where you can imagine there is often barely managed chaos, and that's because too many people are going to ERs that can better be served elsewhere. Now, as far as what patients can do, there's much remedy available to patients. And I've got several tips, and one of them, frankly, is to make a lot of noise. Be your own advocate. Research your health conditions and possible treatments online. Use social media to help you make your selections for healthcare providers. Take it with a grain of salt. It's not scientific. It's not perfect, but it is a good indicator. Secondly, when you go to a hospital, especially for an overnight stay, and particularly when you're undergoing sedation, bring an advocate with you, a loved one, a family member, or a relative, or a friend who can be your second set of ears and eyes. Stay out of ERs, of course, and also just be acutely aware of what's going on around you, and fight back, particularly on billing issues. A lot of people have told me, and we see this in the reviews, that when they're hospitalized, they have a lot of people in white coats coming by their bedside asking if they're okay, if they're hurting anywhere, and they're later billed for these so-called consultations by doctors or nurses or specialists or therapists they don't know, haven't met, and yet they're paying them for their so-called consultations. I think this flies in the face of a bedrock principle called informed consent. So fight back on those kinds of charges and other things that you think are unfair. And lastly, I would say get politically active, make your voice known about our healthcare system to your representatives and politicians. And
document everything when you have an experience with the healthcare system, because you never know when an issue is going to pop up. But one of the most interesting things, again, circling back to where we started, it is interesting that the majority of these complaints, the majority of experience that have patients downgrading their ratings on hospitals, on their hospital experience, really has very little to do with the actual care that they receive. It's everything else that goes around that.
It is ironic, isn't it? We do have some of the best care in the world in many cases. At the same time, we should be aware that estimates range from 250,000 to 400,000 people die every year in hospital and other healthcare facilities from what's called medical errors. This is the third leading cause of death in the country now after cancer and heart disease. So you've got about a 10% chance when you die it will be due to a screw-up in a hospital or other facility. So we do need to certainly be cognizant of that. However, most people can't see the quality of care they're getting. They can see the customer service they're getting. And that's why in another study we conducted, we looked at 35,000 online reviews of doctors, clinics, and hospitals. By 2 to 1, they really like their doctors. They praise their doctors and give them 4 or 5 stars, as opposed to only 32% give their experiences 1 or 2 stars. So it's quite ironic. People tend to be quite happy with doctors and the quality of their care, and they tend to be most upset by the quality of customer service.
But that does underscore the fact that it is the entire package that we have to take care of, because those mistakes that can happen, that can have deadly consequences, sometimes could be the result of these other ancillary things that are going on, miscommunications and so on and so forth. So really fascinating stuff. Again, from Vanguard Communications CEO Ron Harman King with us this morning. And where do we get more information on these studies?
Go to the website tipsforhospitalpatients.com. Tipsforhospitalpatients.com.
We will link up to that on our webpage. Ron, thanks very much for taking the time. We appreciate it.
It's my pleasure, Chris.